When it comes to treating someone who has had a stroke, we know that time is brain. This means the sooner assessments, tests, medications, and treatments are started, the better. Once the person is stable, it is essential to make the brain work. This is where intensive rehabilitation and an active, stimulating environment come into play. During the rehabilitation and recovery process, time is function. This means the more time a person with a stroke participates in challenging, stimulating activities that train him or her for daily activities, the better. Unfortunately, not all stroke patients receive best practice care, and there is a great variability in how much therapy and practice time is provided. The challenge is, how can we create an environment that is recovery-rich, safe, stimulating, and supports restoring function to full capacity? In this video, you'll hear unscripted comments from stroke survivors, family caregivers, healthcare providers, and managers. We traveled across the region to help us learn about rehabilitation experiences and how different teams are making best practices come to life. Keep an open mind and listen for ideas that will boost the intensity of your stroke rehabilitation. The Canadian Stroke Strategy established best practice guidelines based on current research findings. The rehabilitation guidelines give recommendations for initial stroke rehabilitation assessment, stroke rehabilitation unit care, and delivery of inpatient stroke rehabilitation. Research demonstrates that the earlier rehabilitation starts, the better the outcome. In fact, people who start rehabilitation later may never recover as much as those who start early. Early, intensive rehabilitation care for stroke patients improves arm and leg motor recovery, walking mobility, and functional status, including independence in self-care and participation in leisure activities. It is important that the rehabilitation be tailored to individual life goals. In this video, we will focus on 4 rehabilitation best practice guidelines. 1. All patients with stroke should begin rehabilitation therapy within an active and complex, stimulating environment as early as possible once medical stability is reached. 2. Stroke patients should receive through an individualized treatment plan a minimum of 3 hours of direct task-specific therapy by the interprofessional stroke team for a minimum of 5 days per week. This means 3 hours a day of physiotherapy, occupational therapy, and speech-language therapy at least 5 days a week. 3. The team should promote the practice of skills gained in therapy into the patient's daily routine in a consistent manner. 4. Therapy should include repetitive and intense use of novel tasks that challenge the patient to acquire necessary motor skills to use the involved limb during functional tasks and activities. Brain recovery is better when the patient is engaged and really cares about the activity. To sum up the best practice guidelines, a recovery-rich environment includes therapy, practice, and stimulating activities. Let's take a moment to reflect on your reaction to these guidelines and to take stock of the recovery richness of your environment. What was your initial reaction to these recommendations? They are impossible to achieve? Interesting, but we need practical ideas about how to make it happen. Bring it on! We're making good progress and we'd like to learn more about how to get even better. What's the recovery richness of the care environment your patients currently experience? Less than 1 hour therapy per day, less than 5 days per week, with no practice and an environment that lacks meaningful stimulation? 2 hours of therapy per day, plus a recovery-rich environment 5 days a week. 3 hours of therapy a day, plus a recovery-rich environment 7 days a week, including evenings and weekends. Every organization has different resources, processes, skills, and knowledge challenges. The Regional Stroke Network's goal is to collaborate with you so that your hospital can move closer to the best practice guidelines. And we're advocating to get the necessary resources in place.